I'm an osteopathic physician in Mesquite, Texas. I was trained to be a general practitioner, and I've been in practice over 30 years. My undergraduate training was University of Texas at Austin, and my professional training in osteopathic medicine was at the Texas College of Osteopathic Medicine in Fort Worth. In the latter years, I have changed my focus of practice from general practice to the original methods of osteopathic treatment. I have had patients a number of years ago come in and ask me if I could do something about the breast pain they had from trauma to their breasts, such as airbags and other types of trauma. They had been worked up and found to have no problems on mammograms, and they had been previously examined with no discovery of any problems. So what I did is I told them I'd go back and restudy the anatomy of the breast and see if I can figure out something. The method of exam I came up with was to examine the ligaments in the breast. Those ligaments fall within partitions which number 15 to 25 in each breast, and they're arranged in this manner. After a couple of years of trying to figure these type of problems out to help patients, I realized the way I had come up examining the ligaments in these partitions would also be a good way to feel a lump. The lumps start in the milk gland, which then can be a place where your site of cancer starts. And also by feeling this way, it puts you in a place closer to where cancer will start and raises your odds of finding cancer. Also, it has your fingers lined up with those areas which will improve your odds of discovery. So the change, this idea of examining is to have your fingers placed in line with the milk ducts. The milk duct is in front of the fascia on the muscle in the chest wall and goes forward all the way to the nipple. So having your fingers in this arrangement, you can work around one partition at a time until you have covered all the partitions. And both breasts need to be done this way. It takes quite a bit of time, but may allow you to discover a lump quite a bit earlier than in another manner. Also, your position of your fingers, not only is it in line, but is focused on that line where cancer could start. And the angle of your fingers is at a 45-degree angle with the breast, making your fingers closer to this line from front to back. When you do an exam, you will be cupping the opposite side of the breast from this area, and that helps draw tension on that line. I will now go to a demonstration on a simulated breast. We're now going to go to an example of how to examine a simulated breast. I will go over a couple of partition examinations. However, when you're actually doing this exam yourself or your attending physician, you need to go all the way around the breast on each side. This exam can be done laying on your back, and there's no need to hold your arm up, because as you cup the opposite side of the breast, you will draw tension on this line that you're examining. Again, the features of this way of examining that could help you find a lump earlier are that it helps you have your fingers in line with the milk gland. Your fingers are also closer to the milk gland from the back all the way to the front. And your skill for feeling is improved significantly this way. The hope is that you will be able to feel a lump when it's smaller and earlier during the course, that you can go in and get it examined by your physician for evaluation. If you do find a lump, you might ask, how do I know it's not a ligament or not a wall of the partition or something else? And these other areas usually don't have lumps starting in them. So to do this, you cup the opposite side of the breast where you're going to have your fingers pressing, and you slowly press in and give yourself time to feel. Don't rush or be urgent. And as you're sitting there just trying to feel, you will be able to feel better after a little while. The cupping of the breast helps you draw tension on that line, and that's the reason you don't need to raise your arm to do so. You will need both hands to do this exam. After you think you've checked that place, you move to a next place and move the opposite hand directly across and cup the breast and sit there and wait. Your fingers are touching in the back, the grape-like cluster, which also is where fibrocystic changes exist in some people. And you can feel all the way to the nipple where a variety of different type of cancers start. You keep working around this breast till you get the whole circumference covered. Once you finish one breast, then you do the other one. It may be best to do this if you're still having periods after a period, because there's less swelling in the breast at that point than before a period. If you have to in certain positions, you can turn your hand the opposite direction. Like if you're in a certain position, it may be harder to do that, so you could turn your fingers the opposite way, and that's okay. If we have any new information on this, we will come back and redo this film when that occurs. Thank you.